Have you ever walked into a room and completely forgotten why you were there? Maybe you've searched the entire house for your glasses, only to realize they were sitting on your head the whole time. Or perhaps you've struggled to remember someone's name, a person you've known for years. Moments like these can be frightening, especially after the age of 50. Many people immediately think the worst. Is this the beginning of dementia? Am I losing my memory? Those thoughts are completely understandable. Memory is deeply connected to our independence, our confidence, and our identity. But here's something that surprises many people. Not every memory problem is caused by dementia. In fact, one common vitamin deficiency can produce symptoms that look remarkably similar to early Alzheimer's disease or other forms of dementia. People may become forgetful, confused, mentally slow. They may struggle to concentrate, lose their balance, or even experience mood changes. Yet the real problem isn't permanent damage to the brain. It's that the brain isn't getting one essential nutrient it needs to work properly. Even more surprising, many adults over 50 are at higher risk of developing this deficiency without realizing it. The symptoms often develop slowly. At first, they're easy to ignore. Then family members begin noticing changes. Some might say, "You've been forgetting things lately. You don't seem like yourself. You've told me that story 3 times today." Naturally, everyone begins worrying about dementia. But what if the brain isn't failing? What if it's simply missing something it desperately needs? Today, we're going to explore one of the most overlooked causes of memory problems in older adults. We'll explain why it happens, who is most at risk, the warning signs to watch for, and why recognizing it early can make a remarkable difference. Before the end of this video, I'll share one surprising reason why many people become deficient without changing anything about their diet. Let's begin. The nutrient we're talking about is vitamin B12. You've probably heard the name before, but many people don't realize just how important it is. Vitamin B12 helps your body produce healthy red blood cells. It supports your nerves. It helps make DNA, the genetic blueprint found in every cell. And perhaps most importantly for today's discussion, it plays a critical role in keeping your brain working properly. Think of your brain as the world's most complicated electrical system. Every thought, every memory, every movement, every conversation depends on tiny electrical messages traveling rapidly between billions of nerve cells. Vitamin B12 helps protect the insulation around those nerve cells. Doctors call this protective covering myelin. Imagine an electrical wire inside your home. The metal wire carries electricity. The plastic coating around it keeps the signal moving safely and efficiently. If that insulation becomes damaged, electrical signals begin slowing down or getting interrupted. Your nerves work in a very similar way. Without enough vitamin B, coating starts to wear thin. That protective coating can gradually become damaged. Messages traveling through the nervous system may become slower and less reliable. That's when memory problems, confusion, tingling, and balance difficulties can begin to appear. This process usually doesn't happen overnight. It develops quietly over months or even years because the changes are gradual. Many people simply assume they're getting older. But aging itself isn't the real cause. And here's where things become even more surprising. Some people who are deficient eat plenty of foods that contain vitamin B12. So why aren't they getting enough? The answer has very little to do with what they're eating. Many people assume that if they eat meat, fish, eggs, or dairy products, they're getting enough vitamin B12. And they may be. The problem is that getting vitamin B12 into your mouth is only the first step. Your body still has to absorb it. As we get older, that process becomes much less. Here's why. Stomach produces acid that helps separate vitamin B12 from the food you eat. Then, another substance called intrinsic factor acts like a special delivery truck, carrying vitamin B12 through the digestive system so it can be absorbed into the bloodstream. Without enough stomach acid or intrinsic factor, much of that vitamin B12 simply passes through the body without ever being used. Think about watering a plant. You can pour all the water you want into the pot, but if the soil cannot absorb it, the roots will still. Your body works the same way. You may be eating enough vitamin B12, but if your digestive system can't absorb it properly, your brain and nerves may still become deficient. This becomes much more common after the age of 50. In fact, millions of older adults have low vitamin B12 levels without knowing it. Certain medical conditions can also increase the risk. People with chronic stomach inflammation, Crohn's disease, celiac disease, or those who have had stomach or intestinal surgery may absorb much less vitamin B12 than expected, but that's not all. Several commonly prescribed medications can also reduce vitamin B12 absorption over time. For example, medicines used to reduce stomach acid, including proton pump inhibitors and H2 blockers, may lower the amount of acid needed to release vitamin B12 from food. Another medication that deserves attention is metformin. Metformin is one of the most commonly prescribed medicines for type 2 diabetes. It has helped millions of people control their blood sugar safely and effectively. However, long-term use has also been linked to lower vitamin B12 levels in some patients. That doesn't mean anyone should stop taking their medication. Far from it. These medicines provide important health benefits. The key point is simply that people taking them for several years may benefit from discussing vitamin B12 testing with their healthcare professional, especially if new neurological symptoms begin to appear. This is one reason doctors often look at the whole picture instead of focusing on a single symptom. Now, let's talk about those symptoms, because memory loss is only part of the story. One of the earliest warning signs may actually appear in your hands or feet. Many people notice a tingling sensation. Others describe numbness. Some feel as though they're wearing invisible socks or gloves. It may begin in the toes, then gradually spread upward. Others notice burning sensations or sharp, electric-like pains. Why does this happen? Remember the protective coating around the nerves we talked about earlier? When vitamin B12 becomes too low, those nerves may begin struggling to send clear signals. The longest nerves in the body, those reaching your feet and hands, are often affected first. That's why symptoms frequently begin there. Some people even start having trouble with their balance. They may feel unsteady while walking, they hesitate on stairs, or they become nervous walking across uneven ground. Friends and family may think they're simply becoming frail with age, but in some cases, the real issue is that the nerves helping the brain sense body position are no longer working as well as they should. Now, combine that with memory problems. Perhaps someone is forgetting appointments. They're feeling unusually tired. Their feet feel numb. Their balance isn't what it used to be. It's easy to see why dementia becomes the first concern. But this is exactly why vitamin B12 deficiency deserves attention. Unlike many causes of dementia, vitamin B12 deficiency is often treatable. The sooner it's recognized, the greater the chance of preventing permanent nerve damage. Unfortunately, if the deficiency continues for too long, some nerve injuries may become difficult or even impossible to completely reverse. That's why early recognition matters so much. And here's something many people never expect. Memory isn't the only thing that changes. Your personality and emotions can change too. Memory isn't the only thing that changes. Your personality and emotions can change too. This is one of the reasons vitamin B12 deficiency can be so confusing. Family members often notice the changes before the person experiencing them does. Someone who was once cheerful may become unusually irritable. A calm person may suddenly seem anxious. Others lose interest in hobbies they've enjoyed for years. Some become withdrawn. Some feel depressed without understanding why. Others describe a constant mental fog, as if their brain is moving through thick clouds. Simple decisions become harder. Following conversations takes more effort. Reading a book or watching a television program suddenly requires much more concentration than it used to. These changes can be frightening. Naturally, people begin wondering if dementia is developing. But remember, your brain depends on healthy nerve cells receiving oxygen and nutrients every second of every day. When vitamin B12 levels become too low, those brain cells simply can't perform at their best. It's a little like trying to run a modern computer with a failing power supply. The computer itself isn't broken, it just isn't getting what it needs to function properly. Another symptom that often appears alongside memory problems is extreme fatigue. This isn't ordinary tiredness after a busy day. People often describe feeling exhausted from the moment they wake up. Even simple household chores feel overwhelming. Walking across a parking lot seems harder than it used to. Some people feel short of breath after only mild activity. So why does vitamin B12 deficiency cause so much fatigue? One reason is that vitamin B12 is essential for making healthy red blood cells. These cells carry oxygen throughout your body. If your body doesn't have enough vitamin B12, it may produce fewer healthy red blood cells, leading to a condition called megaloblastic anemia. Without enough healthy red blood cells, less oxygen reaches your muscles, brain, and other organs. The result can be overwhelming tiredness, weakness, dizziness, pale skin, and difficulty concentrating. Now imagine experiencing all of these symptoms together. You're forgetting appointments, your feet feel numb, you're unusually tired, you're struggling to concentrate, you've become anxious or depressed. It's easy to understand why people worry about Alzheimer's disease. But in some cases, the real problem is something much more treatable. That's why healthcare professionals often consider vitamin B12 deficiency as part of the evaluation when someone develops new memory problems, especially later in life. Unfortunately, this deficiency is easy to overlook because its symptoms develop slowly. There usually isn't one dramatic moment when everything changes. Instead, small problems quietly accumulate over months or even years. You forget a few names, you stumble more often, you become a little more tired, your family notices you're repeating stories. Each change seems minor by itself, but together they form a pattern that deserves attention. So, who should consider asking their healthcare professional about vitamin B12 testing? Adults over the age of 50 are one important group because vitamin B12 absorption naturally becomes less efficient with age. People who take metformin for diabetes over many years may also be at increased risk. Those who regularly use acid-reducing medications should discuss whether testing makes sense for them. Vegetarians and especially vegans may also have lower vitamin B12 levels because this vitamin is found naturally in animal-based foods. People with digestive disorders such as Crohn's disease, celiac disease, or those who have had stomach or intestinal surgery may also absorb much less vitamin B12 than expected. The important message isn't that everyone needs testing. It's that persistent symptoms deserve proper evaluation. Memory loss should never simply be dismissed as just getting older. Sometimes the explanation is more complex. Sometimes it's something treatable. And sometimes identifying the real cause early can protect both the brain and the nervous system. But that raises one final question. If vitamin B12 deficiency is found, can it actually be treated? The answer gives many people hope. The answer gives many people hope. If a vitamin B12 deficiency is discovered early, treatment is often straightforward. But the right treatment depends on one very important question. Why did the deficiency happen in the first place? If someone simply isn't getting enough vitamin B12 from their diet, increasing foods rich in vitamin B12 or taking an oral supplement may be enough. Good dietary sources include fish, lean meat, eggs, milk, yogurt, and cheese. However, if the problem is poor absorption, taking more vitamin B12 in food alone may not solve it. Some people may need high-dose oral supplements. Others may require vitamin B12 injections that allow the vitamin to enter the body without relying on the digestive system to absorb it properly. The best treatment depends on the individual, which is why it's so important to work with a healthcare professional rather than trying to guess. The encouraging news is that many people begin noticing improvements after treatment starts. Energy levels may slowly return, mental clarity often improves, concentration becomes easier, mood may become brighter. Some people even notice that their balance becomes steadier. But it's important to have realistic expectations. Recovery isn't always immediate. The nervous system heals slowly. For someone who has been deficient for months or even years, improvement may take weeks or several months. And unfortunately, if nerve damage has become severe, some symptoms may not completely disappear. That's why recognizing the warning signs early is so valuable. The earlier the deficiency is identified, the greater the chance of preventing long-term complications. This also highlights an important lesson. Not every memory problem is dementia. Not every episode of forgetfulness means Alzheimer's disease. The brain is influenced by many different factors: sleep, stress, medications, thyroid disorders, depression, blood sugar, hearing loss, and nutritional deficiencies like vitamin B12. That's why healthcare professionals don't jump to conclusions based on one symptom alone. They carefully gather information, review medications, perform examinations, and order appropriate tests to understand the complete picture. If you or someone you love has developed new memory problems, unusual fatigue, numbness, tingling, balance difficulties, or unexplained confusion, don't assume it's simply part of getting older. Those changes deserve a conversation with a healthcare professional. Sometimes the cause may be a progressive brain disease. Sometimes it may be something entirely different. And occasionally it may be a problem that can be treated before lasting damage occurs. Taking action early isn't about expecting the worst. It's about giving yourself the best possible chance to protect your brain and your quality of life. There are also simple habits that help support healthy brain function as we age. Eat a balanced diet with enough protein and essential nutrients. Stay physically active in ways that are appropriate for your fitness level. Challenge your brain by reading, learning new skills, solving puzzles, or staying socially connected. Get enough sleep each night. Manage blood pressure, diabetes, and cholesterol if you have them. And attend regular medical checkups even when you feel well. These everyday habits work together to support both brain health and overall well-being. Your memory is more than remembering names or appointments. It's the collection of your experiences, your family stories, your happiest moments, the lessons you've learned over a lifetime. Protecting your brain begins with paying attention when your body signals that something may be wrong. Sometimes those signals are subtle, sometimes they're easy to explain away, but listening early can make all the difference. If you found this video helpful, please share it with someone you care about, a friend, a spouse, a parent, or a neighbor. One simple conversation could encourage someone to seek help before small symptoms become much bigger problems. I'd also love to hear from you. How old are you, and have you ever had your vitamin B12 level checked? Share your experience in the comments below. Your story may help someone else realize they're not alone. Thank you for watching, and thank you for taking the time to invest in your health. I'll see you in the next video. Until then, stay sharp.